2021 has certainly kicked off in fine crisis PR style. One of the chaotic events of this week has certainly been the delay and confusing rollout of the vaccines to combat COVID. We've seen several states with long lines. We've seen some states waiting still for an adequate number of vaccines, and it's really even gone down to affecting some of the nursing homes who have healthcare workers now reluctant to take the vaccine simply because they're not sure that they can trust anyone. If you are directly involved on a government level or healthcare level in the distribution of the vaccine, you need to step up the game. Now, I know that there are a lot of logistics that are still being worked out, and there's a lot of confusing parts that don't seem to be in place that the assumption was they were. Here's what you got to do. You got to treat the communications aspect of this in the same fashion you did at the start of the pandemic when you discussed lockdown procedures and the number of cases. Talk about how many vaccines are in place within the municipality, how many are actually being distributed and where, how many people are getting inoculated currently, and what you expect for the next day or so. Do this on a regular basis. Give people an understanding as to where the bottleneck is related to your local neighborhood and how you're working with state and federal governments to fix it. If you don't have all the answer, that's okay for now. But the lack of communication, the lack of clear, concise information to the general public is going to cause an incredible amount of angst that when it comes time for them to get vaccinated, I'm not sure they're going to be there in the lines that you need in order to achieve herd immunity in the next several months. Here's what the general public needs right now. They need assurances that the vaccines are coming, that they're safe, and that those who are needed first are going to get it, and where are they in the pipeline. And it starts with a good crisis communication plan.